tonight, this is number 4 in our Weight Management for Breast Cancer Survivors lecture series. So, over the past few months, we've been meeting once a month to talk about nutrition and lifestyle approaches for weight management for those who are breast cancer survivors, as well as those looking to reduce their risk. So, I'm going to share my screen and we will get into it. There will be time for questions, so please feel free to pop your questions into the Q&A section or into the chat box as we're talking, and I promise to get to as many as I can in the time that we have tonight. So bear with me just a moment and I will share my screen with you. All right, so tonight we are talking about weight management for breast cancer survivors and the role of exercise. So just a little bit about me. I am a registered dietitian, health coach, and author of a couple books. I also happen to be a certified Pilates instructor and also do meditation for certain apps and different courses. And at Valley, I work with our breast cancer survivorship patients to help them improve their quality of life through diet, exercise, and other healthy lifestyle habits. I also contribute to the Valley Breast Center social media. We do our monthly food demo on Instagram. So, a lot of resources or a lot of opportunities to get resources through our center. All right, so just cooperate with me. So, this is part 4 of our 8-part series. And I wanted to create this series because I wanted to provide comprehensive support for those on this journey. So things incorporating mindset, nutrition, movement, hormonal considerations, sleep, stress management, and mental well-being. So today we're going to be talking a lot about the role of movement and mindset to help support well-being. So I've said this before, but mostly we will be talking about avoiding unintentional weight gain in breast cancer survivors. But this presentation is meant to be inclusive of all breast cancer survivors and those looking to reduce their risk. So just a little peek at what we'll talk about today. So we're going to talk about exercise for cancer risk reduction, talk about exercise specifically for weight management. We're going to get into strength training. I'll share some tips for creating a sustainable workout routine. We'll talk a little bit about how to exercise, how exercise and nutrition work together for weight management. That will actually be lecture number 5. We'll be doing a much more of a deep dive on that topic, but we're going to touch on that today. As I promised, plenty of time for Q&A. Advance apologies if I'm coughing a little bit. I'm just getting over something, so that's always the last thing to go, right? Is the little cough. So if you see me pausing for water, that's all that is. So that, I've been in the field about 15 years, and this is something that I've seen over and over just for so long. Women have been told that in order to lose weight and maintain a healthy weight, that they should just eat less and move more. And you probably don't need me to tell you this, but unfortunately, that doesn't always work, especially when someone has been through breast cancer treatment. Additionally, menopause, whether it's related to treatment or not, also impacts metabolism and nutrient needs. So, when we talk about weight management, when we're talking about breast cancer survivorship and those who are in menopause, whether it's as a result of the life cycle or a result of surgery or medication, we need to be addressing this piece of the picture. And this is a summary of what we've talked about in some of our past workshops, but just a few important factors that I want you to keep in mind regarding weight management for breast cancer survivors. Some of the things that come up that we need to account for are metabolic changes related to the treatment, such as changes in leptin, ghrelin, which are 2 hormones that regulate hunger levels. Leptin is one that helps you feel satisfied. Ghrelin is one that makes you feel hungry. So sometimes as a result of treatment, those levels can be a little off, impacting appetite. Things like insulin resistance, inflammation, decreased physical activity, loss of muscle. These are all things that can impact metabolism. And then hormone changes related to treatment. So that might be medically induced menopause, or use of aromatase inhibitor, or menstrual cycle changes related to tamoxifen use. These are just a few examples of things that can impact metabolism and hormones, or hormones and therefore metabolism. And then, of course, medication side effects. So things like fatigue, sleep disturbance. We're doing a whole one of these on sleep. Things like joint pain, mood changes, etc. And of course, mental health concerns. We are going to be doing a lecture all about sleep, and stress is going to be one. So we have to keep in mind that things like stress and trauma can absolutely impact someone's weight management journey. I also, as a recap, just wanted to share this slide as well, just some of the common metabolic changes that do happen. So changes with blood sugar and insulin sensitivity, changes in cholesterol levels. And I mentioned changes in levels, especially of leptin, the hormone that helps you feel full. It has been shown that in some studies that certain medications used in breast cancer treatment might impact leptin, making someone more perceptive of when they're hungry, but not so perceptive of when they're full. So that definitely comes up. So some of the benefits of exercise for breast cancer survivors. So studies have shown that physical exercise has been associated with improvement in areas such as quality of life, cardiovascular fitness, body composition. So, for example, muscle to fat ratio, and bone health. It's also been associated with decreased risk of cancer, breast cancer recurrence, risk of mortality related to breast cancer. And regular exercise has also been associated with reduced risk of other cancers and other diseases. And I'll share more specifics on that in a moment. It's also been linked to improved mental health and cognitive function, which can go a long way if you're dealing with a lot of stress and trauma related to treatment. Okay, so how much exercise is needed for risk reduction? This is a big question that comes up. And what the American Cancer Society recommends is to aim for 150 to 300 minutes per week of moderate intensity activity, or 75 to 150 minutes per week of more vigorous activity. So I'll share some specifics on that in a sec. But also, what's important to note is to include a mix of strength training and cardiovascular exercise. And I'll explain why shortly. But okay, so what's moderate intensity activity? So that's stuff like walking, light cycling, yoga, Pilates, tennis, like, if you're playing doubles or, kind of more like mild tennis, light hiking, light yard work, things of that nature. Things where, you are moving, but you could continue to carry on a conversation. Vigorous intensity activity, that's like running, jump rope, aerobic classes, hiking uphill, things like swimming laps, vigorous cycling, heavy yard work, things where you're moving and there's a lot more effort happening where it'd be difficult to hold a conversation, if that helps to kind of differentiate. Okay, so muscle and metabolism. Why do we talk about strength training? Why do we talk about muscle? And I've been in the health and fitness field, like I said, for about 15 years, and I've been begging people to strength train for so long. So I'm really excited that this is finally something people are talking more about. But just something to know: muscle weighs more than fat, but it's more metabolically active. So this means that the more muscle that you have, generally speaking, the higher your metabolism will be. So having more muscle is a really good thing. I always encourage, when it's an option, to, if you're weighing yourself regularly, use a scale that measures muscle and fat and not just the number, because it is possible, if you are adjusting your diet, you're exercising, especially if you're incorporating strength training, which we'll get to, it's not unheard of to actually see weight go a little bit up or stay the same, even as your body composition changes, even as you notice changes in your appearance. Like, for example, if someone, again and again, I've had this happen where someone say they look more toned, they feel stronger, but then they get discouraged because the number on the scale is a little higher or it hasn't gone down at all. But then, so I share that because I want you to understand that it's not just about the number on the scale. The amount of muscle that you have also, that matters, honestly, in a lot of ways. I would say even more. So loss of muscle mass. So when we lose muscle, that has been associated with decreased insulin sensitivity, so changes in blood sugar regulation, changes in cholesterol, fatty liver, chronic inflammation, and slower metabolism, so slower metabolic rate, which can set someone up for weight gain or making it harder to lose weight. Something else to know is that muscle mass declines with age, especially postmenopause. So, just naturally, as a part of the normal aging process, we start to lose muscle often in our 30s, 40s, and every decade we continue to lose more. Um, so, if someone does nothing or they make no adjustments to their nutrition or their exercise routine, that will just continue and that person will experience metabolic changes and body composition changes. But a few things that you can do to offset those changes, that loss in muscle mass that would come from age, would be to strength train and consume adequate protein to protect against muscle loss and to build new muscle. So again, we will touch a little bit on how to do that, how those things work together. But I just wanted to share that muscle really matters, and this is why. Okay, so what counts as strength training then? So you're looking at stuff like lifting weights, kettlebell exercises, using resistance bands or similar tools. So like other tools you might see like different like gliding discs or um, different tools where you're building resistance. So like loops and things like that. Body weight exercises. So planks, push-ups, pull-ups, squats, lunges. I wrote lunges. The dietitian hazards of the occupation. And then isometric exercises where you're holding a particular, like you are um, like flexing your muscles or holding a particular position. And in that stillness is where strength is built. But I always like to say if you're new to exercise or you haven't been active in a while, ease into it at a pace that's appropriate for you. There's no race, there's no contest. It's really about listening to your body and look and tuning into movements and routines that serve you where you are right now. And all movement counts. If you're in a season of recovering from surgery, an injury, or another issue, prioritize healing first. When we try to get into movement too soon or do too much all at once and our body's not ready for it, that can cause further injury or prolong the healing process or, set us back a little bit. So don't be afraid to prioritize healing first. So a question I get sometimes is, do shorter bursts of activity count? And the answer is yeah, it sure does. A growing body of research has shown that shorter bursts of physical activity actually offer benefits like decreased disease risk and improved cognition, improved mood. One of my favorite examples of this is a study that was published in the journal Nature in 2022. It showed that just literally 3 to 4 1-minute bouts of physical activity every day were associated with up to a 40% risk reduction in all cause and cancer related mortality, and up to a 49% reduction in death related to cardiovascular disease. That is huge. Literally, from moving a total of what is it, like 3 to 4 minutes a day. Like that's big. That's a big deal. So I share this because I want you to know that you don't have to be hitting the gym for an hour to reap the benefits. Even a little bit of movement can be really meaningful. So 1 second. So, okay, so we talked about the benefits of exercise, but how do we be consistent with it in real life, right? I always say that, it's one thing to be in a good routine with fitness or diet, when things are common life, but then life, when is life really ever that calm, right? Like, I think that it's, some of the most common barriers I see my patients struggle with are things like time demands, energy demands, caregiving, being really busy with work and life. And it's important that our routines can fit into our lifestyle. So, a few things that can help you build a healthy exercise routine would be choose exercise you enjoy and can be consistent with. That is huge. If there's an exercise, I don't care if it's like said to be the healthiest thing on the planet, the best exercise. If you don't like it, don't do it. Do something you like instead. There are so many things that you can do. And start with smaller amounts if needed. If this is new to you or you haven't been active in a while, start with a little bit and gradually build up. So something else I've seen be very useful is planning workouts ahead of time. So this can be as simple or as complex as you want it to be. I mean, today we have so many cool resources like apps, for example, that can help us build a routine by like selecting which on-demand videos we're going to do, or you can write down what type of exercise you're going to do in your calendar, either in your phone. You can put it on your refrigerator or a place in your home you're going to see it all the time. Um, but I have found that when we know ahead of time what we're doing, it just makes it easier. There's fewer barriers. Decision fatigue is a real thing. And you've had that experience where you're like, all right, I know I need to work out today. And then, maybe you're like, okay, I think maybe I'll go for a walk, or maybe I'll do a YouTube video, or maybe I should go to a yoga class. And then you're spending all this time looking for the video, or you're checking the weather. You're trying to get motivated to go outside because maybe it's cold out, and you're like, maybe I don't really want to go for a walk. And then you just end up, trying to make these decisions, and it doesn't go anywhere. So I would just say to know that do what works for you, but planning ahead can really save you the decision fatigue. Um, Also having a few different options, you have flexibility. So maybe you wake up and you would normally have done XYZ exercise, but you wake up like, my knee kind of hurts. I don't think that running is for me today. So if you have a backup like swimming, or maybe that's a day you decide to do some stretching or some strength training, like you can still be active. You're not locked into one thing and pushing yourself through it when it doesn't feel right for you. Also important, make sure you have the clothing and or gear that you need. So an example, it's as we're talking tonight, it's cold out. So if you like to walk outside, maybe you get a pair of thermal leggings, you wear layers when you go outside, you have a hat and gloves, you proper footwear, when you have the clothing or gear you need. So if you're going to be doing strength training, having weights in your home or weightlifting gloves or whatever it is that you need, that can help a lot. Putting those workouts on your calendar and or setting alerts to remind yourself, this goes hand in hand with planning it. But if you are someone who needs reminders, I'm a big fan of setting calendar alerts. Also being accountable to somebody, whether that's a coach, whether that is a friend, a colleague, that can help you show up when you're not feeling as motivated. Also, things sitting less during the day, that might not sound like much, but there's a newer body of research really showing that when we're up and moving around during the day, that's been associated with a lot of benefit. Um, so if you are someone who has a sedentary job, anything that you can do to be up and moving about can be very useful. So, um, for example, that might look like setting a reminder to get up once an hour. I have a few patients. They drink a lot of water during the day because then they have to get up to pee and then they get some steps. Or just making a point to take a walk, like a few short walks over the course of the day. Um, I've worked with people who they use a standing desk or a treadmill desk, or they put a little under desk cycler machine at their job, or if they're at home watching television, that's where they put, some kind of equipment that will allow them to be active while they're doing, just day-to-day things. And then lastly, track progress. If you find it motivating, that can be a really useful thing. If you notice how far you've come, it helps you feel good about that and stay motivated to keep going. And just a reminder, do not be afraid to ask for guidance from a trainer, a physical therapist, or fitness instructor with expertise in breast cancer survivorship. And I know that time can be a major barrier. That is definitely a real factor. So when you feel like you don't have time, here are some tips for finding time for movement, or making time, I should say. If we're waiting to find the time, it's probably not going to happen, right? We have to be proactive about making that time. So choose an activity that you enjoy and can sustainably fit into your life. Also helpful to identify a time of day or times that are most convenient for you to move, and then put it on your calendar and set a reminder if you need to. And as we talked about earlier, break activity into smaller bursts if that makes it more approachable. So barriers, it's just a part of life, right? Like stuff happens. And I think that anticipating those barriers can be really helpful in allowing you to come up with a plan to deal with those things so that you can be consistent. As I said, it's one thing to be consistent with a routine when everything is kind of like moving along at a calm pace. But then what happens when you're going through a really rough patch and things are very stressful? And honestly, those really difficult times are when we need movement the most for the health benefits, physical and mental. So a few ways to make plans to deal with potential barriers. Plan and schedule those workouts. Give yourself options. Um, and from a mindset perspective, remind yourself that every little bit of movement has some benefit. So don't tell yourself it doesn't count because it's not your usual volume. And then working movement into everyday tasks. So pacing while you're on the phone, using an under-desk cycler while you're on a Zoom call, setting up a walking pad under a desk and getting a little stand for your laptop or something like that. Anything we can do to work movement into our day can go a long way. And then fueling your fitness is really important. You need to eat enough to support physical activity, help your body recover from exercise, and build muscle. So, a few ways to do that. And as I said, we'll go way more into this in the next session, but you want to include complex carbohydrate and adequate protein at meals and snacks. Also, timing snacks and meals around workouts can help you get the most out of that time and energy you're putting in. And don't forget to hydrate, that's important too. Okay, so I understand that the internet is the wild west of health information, right? And we've talked about this being the case for nutrition, but it's also the case for exercise. So, just some tips for navigating all that. Consider the source and ask yourself, is the author or influencer, are they credentialed, or does the resource that you're looking at, does it include insight from credentialed experts and or research studies? Um, is this resource intended for people with your specific health concerns? And or do the quoted experts work with people like you who have those concerns? Also, just something to keep in mind, this isn't always necessarily like a complete deal breaker, but is that resource sponsored and or selling something? Sometimes, there are experts who are affiliated with particular companies, um, but just to know that sometimes there's a lot of content out there that sometimes is only geared towards selling, and that's coloring the advice that's being given. So just something to be aware of. If you do decide to work with a trainer or exercise expert, so especially someone who has expertise in breast cancer survivorship, this can really help you come up with an individualized plan to support your goals. So, some things to look for with a trainer will ask you about your health history, your goals, your current habits, your lifestyle, kind of do an intake. And they'll also provide some fitness education, um, demonstrations, recommendations for exercises to support your goals. They'll coach you through exercises, and they'll also offer support and accountability. Some trainers will also create resources that you can follow at home, whether that's written plans, videos, just ways to maintain that activity even between your sessions. So I will stop sharing my screen. I just want to open it up for questions now. No, wow, this is great. We got 31 people on the call. That is amazing. So I'm going to look in the Q&A section here. Okay, so I got a question asking joint pain related to anastrozole. Um, so medications have side effects, and one side effect of anastrozole is joint pain. Not everybody will experience it, but it is a known side effect. So this can come up at you know how this can impact physical activity is that it may influence exercise tolerance. It may influence the type of exercise somebody can do, the amount, the intensity, the duration. So there can be a learning curve with that. And obviously, that's a conversation to have with your oncologist about choosing the right medication regimen, the right dosage, routine, what time of day are you taking it. But for example, if someone's dealing with joint pain while they're on a medication, whether it's anastrozole or another medication out there that may cause joint pain, then you can explore alternatives. So, for example, if you're a walker or a runner, maybe you explore swimming or rowing or things that are not going to have uh, that impact as well. You can explore strength training, mobility exercises. So there's a lot of I have, I've been like as a fitness instructor, as someone who's been physically active most of my life, I've definitely dealt with injuries, and I think in times where we need to be taking a step back from movement for like medical reasons, things along those lines. And I think what's important is when we do experience a setback or an injury or something new, I think that those can be really great teaching experiences. And it can be an opportunity for us to explore other things. Um, so, all that to say, I think that, and whether this is related to breast cancer treatment or not, often as we age, that's also, we notice that our body responds differently to different types of activity. So, that's a really good time to explore new things. So I hope that that addresses your question. Um, all right. And then I also see a question um, asking if my slideshow will be available. Yes, so all of this will be available. You'll be getting a link to where you can view a replay. So the slides will be there. You'll be able to see all that. So thank you for asking that. So yes, the slides will be available. Any other questions? Okay, so I also see a question asking if you've had a mastectomy, and so if it was in the longer, like so asking, if you had a mastectomy 8 years ago, can you lift weights? That's a great question. So yes, it. What I will say is that right after surgery, you do need to wait till after you've been cleared by your surgeon to start incorporating different types of movement. But generally speaking, once somebody has healed adequately from a surgery such as a mastectomy, they can eventually go back to things like lifting weights. Initially, it can look and feel different. They may have to start with lighter weights, more specific movements that are safer. But I think that, but yes, you absolutely can lift weights, but I would encourage starting with a trainer or a exercise physiologist, a physical therapist, someone who has training and supporting those with breast cancer. I know that Valley does have a program for their breast cancer survivorship community. So if you get your care at Valley, I would encourage you to ask your provider about that program, the exercise program. Um, but I do encourage I mean, I think weight training is wonderful. So if you're not ready to lift weights, it's not something that you've done before, starting with gentler things can also be really effective too. So resistance bands, body weight exercises. There's a lot of ways to build strength. I also see another question asking, um, let's see, other question if other sessions can be available. Yes, all of that will be available. There actually is a website where all of this lives. So I when you get an email with the replays, you will get a link to the place where all of the content lives. So I'll make sure I follow up with the team to make sure that that's all shared with you. I know that the first two, maybe even the first three are up there. So yes, yes, all of this will be available. All right. Any other questions? Okay. All right. So any last questions? Oh, okay. So I have someone describing strength training band exercises. Okay. So a resistance band um would be like usually it'll be a stretchy band or a loop. So yeah, something for you to walk away with. Of course, that's why we're here. So a strength training band exercise would be where you have, say, like a resistance loop. Um, and you could have it, you could have it around around your hands, and you could be either pulling to do some kind of like row, so you're working these muscles. You could, if you're pulling across, that could be working your chest muscles. Obviously, all of this is if you are cleared by your provider. Um, you could do something if you have a longer resistance band, like a long, very long, stretchy band. Um, what you could do is you could put your feet on that band and then do like some upright rows. You could do bicep curls, so where you're kind of working like these muscles. You could do like an overhead tricep where you have it behind you and are pulling up. You could, for lower body, you could put a resistance loop around your ankles or around your thighs, and doing things like squats and lunges with the added resistance of those bands, those loops. So yeah, those are just a few examples of how somebody might use resistance bands or loops in an exercise for building strength. All right. I see one more question, I'm sorry, asking if they'll receive emails about upcoming webinars. Okay, so in order to receive emails about the webinars, you need to sign up for them. So on the Valley Health system, no, valleyhealth.com/events, you will see all the remaining series, and you can sign up for each individual one. So anyone that you sign up for, you will get email communication about how to join it, how to access it, and then you also will get the link to the site where the replays can be found. So that's a great question. Thank you for asking that. All right, I got another question. Where did it go? I got a question asking if a knee or a body part hurts, is it better to push through the pain or stop? Um, I always say pain is a warning signal that something is wrong. So if you are experiencing pain, hold back. I think that sometimes it needs rest. Sometimes, if it's an ongoing situation, I do encourage following up with your doctor, maybe getting a referral for an orthopedist or a physical therapist, someone who, depending what body part it is, can help you address, identify the root cause of where that pain might be coming from. But yes, I always encourage be safe. Um, if it's something like that, if let's say it's knee pain, right? That someone they just know that they've had knee pain for a long time, and it's just really, there's not much they can do about that right now. That's a time to lean into other types of movement, so maybe that's when you look at swimming. That's when you maybe consider, those are maybe good days to do strength training, or maybe you do shorter amounts of activity that involve impact. So maybe an hour-long walk is not for that person, but maybe, a few 10-minute walks through the day, you'll get just as much benefit. Or maybe light cycling is a good fit for looking at cardiovascular activity. So again, an opportunity to explore things that do work for you. Yes, and I see someone shared valleyhealth.com/events in the chat box for where to find the sign up information. All right. Anything else? And I want to thank you all for being here tonight, by the way. It's really, I know there's a lot going on, so it means a lot to me that you all took some time out of your evening to be here. Okay, a question asking classes offered at gym that would be considered strength training, walk and tone, etc. So a class that would be an example of strength training, something that involves weights. Um, you'll select anything that is involving resistance. So that could be like things like band exercises, things with weights. Often, like sometimes boot camps will incorporate some weight training. They usually have a combo of strength and cardio. Sculpting, that's a good keyword for or toning, sculpting, those are good keywords. Um, so I hope that that is helpful. Um, it's something that is more cardio would be like a running club or I get questions, okay, like what about yoga? What about Pilates? And That really depends on the level of intensity. I would say Pilates could be considered strength training to a degree, because you are building up core strength, which is really important for mobility, flexibility, avoiding injury. And certain types of Pilates, you are building strength through resistance using props and things like that or equipment. Yoga, it kind of depends. Like a restorative or a yin yoga class is not going to be strength training, but a vinyasa class where you're moving more quickly, more fluidly, that may offer some strength building benefits. A yoga sculpt class or a yoga Pilates class, that's also likely to be incorporating some strength. Rowing, if you are somewhere where there are rowing classes, that can be a great combination of strength and cardio. Um, I know I'm forgetting some, but those are just a few off the top of my head. I'm getting a question about what would work for people with lymphedema from radiation and joint and knee pain. So I do encourage when dealing with lymphedema, this is a good time to work with at least to just get started working with a specialist who has some training in this area. So that might be like a lymphedema specialist or a trainer who is trained in working with people who've been through radiation and dealing with lymphedema. Joint and knee pain, a physical therapist can be a great resource. And typically, in any of these cases, it'll be looking at what specific movements are appropriate and how to modify. Because, I think that every body is different and everyone's dealing with different limitations. So there are ways to get the benefits of the different types of movements, but sometimes it requires modifying by, say, like using different equipment or changing if we're sitting or standing or, different levels of intensity. So it is really individual, but it can, you can make it work for you. It just may require getting a little bit of guidance as you're getting started. I got a question about whether AOA chair classes are enough exercise. Um, I'm going to be totally honest, I don't know what AOA is. But what I will say is that chair classes can range from being very gentle to really intense. I actually just taught a chair exercise workshop the other day that was actually pretty intense. Like you can really dig in there. I think though at the same time, if you're looking at like a chair yoga class, it's really great for like you can see classes that are really good for gently incorporating mobility, flexibility exercises. Sometimes I think chair classes can be wonderful because if you don't have the strength to really be standing for long periods of time, having the support of a chair can really help you. For example, if you are just starting to work on doing some arm exercises or some leg exercises that maybe aren't as accessible when you're standing, I think they're a great alternative. Or if you can't be, supine, you can't be on your back, also a great option. So I'm a big fan of chair exercises. I think that it just depends on, there's a big range, and I apologize that I don't offhand know what AOA is. So I hope that what I did share is at least helpful in understanding. But thank you for asking that question. Chair exercises can be really great. Excuse me. Thank you for your patience with my my voice. I'm glad it's at least cooperating a little bit today. Right. Any other questions? I know we've been covering a lot of stuff here, and I just want to thank you all for sharing your questions and your thoughts with me. This is always great. All right. Okay. All right. Active older adults. Thank you. Thank you for sharing that with me. Yes. So again, I think it will depend on the class, but I think that um, that sounds like a really great option. If someone is doing these classes and they find that they start to feel too easy or they don't feel like they're making progress, that's a sign that maybe, it would be beneficial to increase the intensity slightly or introduce something new to do on another day. But I think that sounds like a really wonderful option. And thank you for sharing with me what that stands for. I learn new things every day. Yeah, and thank you. I just think thank you. I'm glad that you're finding this information helpful. And like I said, there will be a replay. You can sign up for the remaining sessions to get access to the live sessions and or those replays. Because even if you can't make it live, or if there's a difference in schedule or something, you can still get access to all of this information. So I would encourage you guys, if you're interested, to sign up, and that way you can get access. All right, so I think we're gonna wrap up. You guys have been wonderful. Thank you so much for being here with me tonight. I appreciate you so much. I hope you found this useful. And yeah, I sign up for the rest if you want to see more. And I'll make sure we get you guys the link for the replay when it's available. And so you can also access the previous session. So thank you all and have a wonderful, wonderful evening.